welcome to another toggle recoil video. My name is Dr. Kevin Pekka. If you are enjoying our episodes, please hit that subscribe button below, share it, and thank you for watching our content. Today I want to do toggle recoil level 3 lower cervicals. So we talked about neurological leg checks, we talked about the atlas, how it moves forward and backwards, and how to correct that. Now we're going to talk about how to correct the lower cervicals in the neck. I would say about 20%, 25% of my patients are strictly just a one-sided atlas listing. The rest have two-side bilateral atlas listings and lower cervicals involved. So it's a very important aspect of clearing out your patients. The number one way to detect a lower cervical subluxation is through x-rays, 3D CBCT scans, digital x-rays, or plain film. That is the number one way to detect a subluxation. It's very important in the upper cervical work, and I would argue that you need it to be effective in this work. Now, once you know your lower cervical listings and how you want to adjust it, now you got to deliver the goods and correct it and fix it. So we're going to go over how to correct an anterior lower cervical and a posterior lower cervical. Now, if you know how to do a C2 lower cervical, you're going to know how to do the rest of the spine because it's the same exact adjustment. You just got to correlate it with the right segment. So after you look at your x-rays, you find out that your lower cervicals are misaligned. This is how you correct it. So first, we're going to go over how to correct an anterior lower cervical subluxation. Okay. So C2, we're going to say has gone forward like this on this left joint. So what we like to do in our office is we like to get the precise joint angle right here, lay it over the person's head. This is our stance line. And this is our ulna line, where we place our hand. And so, I'm gonna put this right here. We're gonna go palpate C2. We're gonna move over. We're gonna put our tissue slack down like this, and we're getting right on that joint. And we are slipping it down that track right here. So there is a little bit of torque in this because it's gone forward. You have to bring it back. So we're just, you can practice up against the wall. You want to make sure this stays in the same position. You're torquing it back down, just like that. So I'm going to show you what this looks like in real time. The joint has got, the bone has gone anterior. So we are doing tissue slack this way. We're getting right on top of it. We're still white knuckling like we did on the atlas. You are not wrapping your hand around because you're going to hurt your thumb. Your thumb is going right here, white knuckle, and you're going boom. My arm is going here to here, boom. Good. You could toggle it. You could do a nice little toggle like that with just a slight torque. So what that's going to look like is this. Just a slight torque. Good. And keep in mind, you're going to want to be very light, gentle, and precise. These adjustments don't have to be hard. That sound you're hearing is the headpiece clicking down. The adjustment is very, very light in itself. So what you do on one side, you can apply to the other. So if there was a right anterior misalignment, you flip them around. The right shoulder is going to be up. You use your right hand. You get that joint angle, and you toggle torque it a little bit down. Right down that joint. Now there is a couple different ways to do the posterior misalignments. Obviously, if a bone has gone posterior, it's slipping backwards like this. So you need to either ride it up the joint or come around the other side and toggle it down. Let me show you what the toggle down side looks like. So for this, we are going to say the joint has gone posterior on that right joint. So the spinous has moved left, like that. So if the spinous has gone up like this, you're going to find C2, get right on that C2, and you're going to do a very nice light toggle back down that joint line, just like that. So find the C2, push it down, put the joint right, put your hand right on the spinous process, white knuckle. You can wrap your thumb on this one because there's no torque. Boom. So that is a toggle torque down. If for whatever reason a person can't lay on that shoulder and you need to do it on the other side, or there's other structures involved where it's not letting you do it on that side, you simply flip them around. So this is the same adjustment on the other side. So we said it went posterior. So on that first adjustment, they were like this. We toggled it back down. So say they can't lay on their right shoulder, you're going to flip them around on your other side, and you're going to slide this joint back up. So you're going to find the C2. You're not on the spinous process on this one, you're on the lamina. You're going to go like this, and you're going to ride it back up. Ride it back up the joint. So let me show you what that's going to look like in real time. So again, this one we are riding back up the joint. We're not pushing it down. So we're going, you have to get low on this one. You wrap your thumb, it's kind of like this. So let me show you what that's going to look like. Tissue slack is up the joint because it's the line of correction. We're white knuckling. You can use this part of your hand for the adjustment. You can ride it back up like that, or you can do full torque and just. The goal is to get this, because it went posterior, back up where it needs to be. So you have to be on that exact joint line. It's the angle you're getting off the x-ray. So here, for argument's sake, let's say it's 35. That's the person's joint angle. I'm standing right here. And we are just riding it back up the joint angle. Boom. You have to get a little bit lower on that one. Both adjustments are very effective. Lower cervicals, they play a big part in the upper cervical misalignment. So if your patients aren't clearing out with just an atlas misalignment, it could be two things. It could be they could have a double misalignment and you're only getting one side, or there could be lower cervicals involved. And once you clear those out, your patient should do really well. If you have any questions, please leave them in the comments below. Don't forget to subscribe and watch some more of our content. If you would like any other videos for us to make, also drop them in the comments section, and we'll see you guys soon.